For some patients, a change to the position of their teeth requires more than can be achieved by orthodontic braces alone. For these patients, surgery to move the jaws into the proper position will also be needed. This surgery is called orthognathic surgery, and it's used in addition to orthodontic braces to move the teeth so that they meet correctly, helping with problems such as chewing food, a poor bite that's maybe damaging teeth, and poor appearance. But just what's involved in this process? Basically, there are three main stages to the treatment. First, the patient's fitted with fixed orthodontic braces to start repositioning the teeth. Then, when the teeth have reached a suitable position, orthognathic surgery is performed to realign the jaws. And finally, following the surgery, the brace treatment continues until the teeth match the new jaw position. Success depends on a team approach throughout the treatment. Your dentist still remains responsible for making sure your teeth, gums and mouth are healthy, so you still have to have regular checkups with your dentist as normal. However, the orthodontist is responsible for correctly positioning your teeth using braces, and the maxillofacial surgeon is responsible for the surgery. And of course, you're responsible for good daily oral hygiene. It's important to understand that this type of surgical and orthodontic treatment requires a long-term commitment. The fixed braces will be on your teeth for up to 3 years or so, with the surgery taking place around halfway through this period. You might find that the orthodontic treatment before surgery actually makes your bite become worse, but don't worry, this will be put right with the surgery. However, if you decided not to go ahead with the surgery, your teeth could be left in a worse situation than they were at the beginning. So, once started, you do need to keep up with the treatment. You'll have to be prepared to take time off work, school or college regularly because you'll need regular appointments for brace treatment, usually every 4 to 8 weeks throughout the whole treatment. Your orthodontist will discuss exactly how often. And on top of this, you'll also need another 4 or 5 weekly appointments immediately before and after your jaw surgery. So, if you think it'll be difficult to keep all these appointments over the whole period, it might be best not to start the treatment because your teeth could be damaged without the regular supervision. And of course, you can always consider treatment later if it's not the right time for you just now. So, what can you expect to happen? Planning your treatment is perhaps the most important part of the process. Planning takes time and will probably require several lengthy visits to see both the orthodontist and the maxillofacial surgeon. You'll be seen at a special clinic or joint clinic, where both the orthodontist and the surgeon will discuss treatment options with you and explain what changes any treatment's likely to produce. In fact, quite a number of photos, x-rays, measurements and records will be collected before a treatment plan is finally agreed with you and before any braces are fitted. There could also be several of these joint clinic appointments throughout the course of your treatment, especially when it gets close to the time for your jaw surgery. Once a plan's been agreed with you and you're certain you want to proceed, then the orthodontist begins the process of moving your teeth. Fixed braces are placed on both upper and lower teeth to gradually move them into a position ready for the jaw surgery, and in some cases, teeth need to be taken out to make space, so that all the other teeth can be straightened. But what about the orthognathic surgery itself? You'll normally be admitted to hospital the day before your operation, which is carried out under a general anaesthetic, and usually stay in hospital for between 1 and 5 days. It all depends on the type of surgery you've had and how fast you recover. Just like any surgical procedure, you'll need time to recover afterwards and let your body begin the healing process. After you get home, there'll be weekly outpatient appointments to check how you're getting on and how you're healing. When it's suitable, the orthodontist will continue adjusting the braces to finally move your teeth to produce the best smile and bite for your new jaw position. Fixed brace treatment will probably last for anything up to 12 months after surgery. By then, your lips and cheeks will have adapted to the new positions of the teeth and jaw, and the braces will finally be removed to reveal the end result. After removal of the fixed braces, it's usual to be given retainers to help keep your teeth in their new position. There are different types of retainers, but whichever type you have, they'll need to be checked at intervals by your orthodontist. Finally, you'll have follow-up reviews, usually each year for about 3 years, with both the orthodontist and surgeon together, just to check that everything's going well.